LeBron James's son Bronny was rushed to a hospital July the 24th after suffering a sudden cardiac arrest during a practice session at USC. A spokesperson for the family told TMZ Sports that Bronny, who recently committed to the USC Trojans, has since been treated by medical staff and is now in stable condition. Though very little information is known about the situation, billionaire Elon Musk, the owner of half a dozen companies but no medical doctor, decided to chime in. "We cannot ascribe everything to the vaccine, but by the same token we cannot ascribe nothing," he tweeted. Myocarditis is a known side effect. The only question is whether it is rare or common. Recent studies, however, have found myocarditis to be a rare side effect of the mRNA vaccines. One study found that while it was the most common post-COVID immunization cardiac event, its rate of occurrence was only 1.62%. A separate study of the entire population of an Italian province that ran from January 2021 to July 2022 found that the COVID-19 vaccine didn't increase the risk of adverse events, including heart attack, cardiac arrest, and myocarditis. A study by the CDC found that the risk of heart complications among men aged 18 to 29 was around 7 times higher after a COVID infection than following COVID vaccination. Myocarditis after vaccination, for the most part, appears to be transient, and these patients recover, Dr. Akiko Iwasaki said. In comparison, getting COVID could lead to more severe, more prolonged myocarditis. But sudden cardiac arrest is not an uncommon thing among athletes, specifically young men. Shaquille O'Neal's son, Sharif O'Neal, suffered a heart complication in 2018 as a teenager. And several studies have identified sudden cardiac arrest as the leading cause of death in young athletes. A 2016 study stated that there are clear health benefits to exercise. Even so, patients with cardiac conditions who engage in exercise and athletic competition may on rare occasion experience sudden cardiac death.